Have you ever wondered how cultural backgrounds can shape our experiences and perceptions? In the world of social work and client assessments, understanding these cultural nuances is not just important, it's essential. Let's explore different assessment approaches that we can use in the social work practice. There is indeed a crucial need for social work practitioners to comprehend the influence of race, ethnicity, and other sociocultural factors on client assessment. Let's examine the limitations of standardized measures and clinical diagnostic categories for multicultural assessments and see how the ethnocentrism of the US majority culture may result in assessment tools that disregard culturally distinct ways of thinking, feeling, and behaving. This has historically led to misdiagnosis and distortion of ethnic and racial populations, a phenomenon that was called cultural malpractice. Let's talk about skills necessary for culturally congruent and ethical assessment for American Indians, Alaska Natives, African Americans and Blacks, Hispanics and Latinos, and Asian and Pacific Islander Americans, groups that have been disproportionately subjected to inaccurate and culturally biased assessments, diagnoses, and interventions. By 2060, historically excluded racial and ethnic groups, including African Americans, Latinos, Asian Americans, and Native Americans, will comprise 56% of the US population. Despite their increasing numbers, these groups face significant economic, political, and social disadvantages. The social construction of race contributes to societal stigma and negative outcomes due to the prevailing Eurocentric bias. Let's talk about demographic and sociocultural experiences of these groups and factors that may impact a client's clinical presentation during assessment. Native Americans, Native peoples, and Indigenous Americans refer to the descendants of pre-Columbian inhabitants of North America. They make up 2% of the US population, but that number is growing due to increased birth rates, decreased infant mortality, and increased identification with the Indian ancestry. Despite their rich cultural heritage, many Native Americans live in poverty, facing significant health problems, including high rates of PTSD and substance abuse. Research shows that Indigenous adults are at high risk for mental health problems. Native Americans have many protective factors that often include strong cultural, familial, and community support. Engaging with tribal cultural activities and maintaining close family and social support are essential strengths for Indigenous Americans. African Americans and Blacks, numbering over 43 million, constitute 13% of the US population. Black people have diverse roots spanning Africa, the West Indies, South America, and the Caribbean. Compared to the general population, African Americans face a 20% higher likelihood of serious mental health problems, such as PTSD, major depression, substance abuse, and suicide. Some of the factors that contribute to this are historical trauma from slavery, systemic oppression, and genocide. However, only about 25% of African Americans seek mental health care. Positive racial identity, Afrocentric orientation serve as crucial protective factors, enhancing mental and overall health. Among African American adolescents, these values correlate with reduced behavioral risks and higher self-esteem. Hispanic and Latino encompass diverse ancestries from Latin America and the Caribbean. Latinos, the largest racial and ethnic minority in the US, number approximately 57 million, with Mexican Americans constituting 65% of this population. The actual count may be higher due to undocumented immigrants. Latinos face challenges including poverty, discrimination, and immigration-related issues. Although they generally have lower rates of mental illness than non-Latino whites, Latino youth are more prone to suicidal ideation and attempts. Also, Latinos often underutilize mental health services due to language barriers, fear of racism, and potential cultural misunderstandings. Protective factors for this population include strong family ties, positive interpersonal relationships, and a strong ethnic identity. Asian and Pacific Islander Americans are a diverse group with over 18 million individuals in the United States. The model minority myth suggests they integrate successfully into mainstream culture, but it overlooks common stressors such as racism and discrimination. While overall, Asian Americans have lower rates of mental health concerns, there's a high suicide risk among high school students and young females in this population. Most young Asian Americans rely on friends, family, and religious communities for support. However, language and cultural barriers often prevent them from seeking professional mental health services. Protective factors include maintaining cultural heritage, strong ethnic identity, bilingualism, family support, and ethnic community connections. Human functioning is influenced by cultural context, with some aspects unique to the client's culture and others common across cultures. Eurocentric culture tends to impose its perspective, which can be detrimental to historically disadvantaged racial and ethnic groups. Practitioners must avoid treating all individuals with the same assessment tools and assumptions about mental health, as this can lead to misdiagnosis. Flawed assessments often result from practitioners' bias, reliance on stereotypes, and culturally biased assessment instruments. Practitioners must be aware of cultural differences and avoid glossing over cultural components during assessment. Practitioners' biases and lack of cultural awareness can lead to misdiagnoses and disparities in mental health care for historically excluded racial and ethnic groups. For example, African Americans often receive more severe diagnostic labels, higher doses of psychiatric medication, and less frequent diagnostic testing. Latino clients' cultural beliefs may be misinterpreted as psychotic symptoms. Ancestor veneration, common among people of African descent, may be misdiagnosed as hallucinating. Practitioners must be aware of their own cultural orientation and values to avoid imposing them on clients and exacerbating disparities in mental health care. One way to approach it for social workers is to use self-assessment to understand the influence of their own culturally learned assumptions on the assessment process. Over-reliance on stereotypes and over-generalizations during client assessment can lead to incorrect assumptions about the client's beliefs, values, and behaviors. This is often seen when practitioners assume that a client's racial or ethnic status is equivalent to their cultural identity, leading to misinterpretation of the client's behavior. Cultural identity and cultural identification are two distinct concepts. The former refers to a person's membership in an ethnic group, while the latter refers to the extent to which an individual identifies with a particular culture. Practitioners must consider a client's unique cultural orientation and identity, taking into account other variables such as class, gender, age, religion, immigration status, sexual orientation, and educational level. Ethnic identity is a cultural aspect of self-concept, and the multi-group ethnic identity measure can be used to assess this. Practitioners should always ask clients about their ethnic group orientation and identity before administering assessment instruments. Many standardized assessment tools used by social work practitioners are based on majority culture perspectives, potentially overlooking the unique experiences and values of individuals from diverse backgrounds. This cultural bias can lead to misdiagnosis or misunderstanding of individuals from ethnic minorities. For example, while these instruments may have high reliability, they might not accurately capture the nuances of mental health in non-mainstream cultures. Asian Americans with depression, for instance, might express their symptoms more somatically than emotionally, leading to potential misdiagnosis. Also, certain concepts critical to mental health may lack precise translations or cultural interpretations outside of a white American context. For example, Alabama Parenting Questionnaire contains a question asking whether parents drive their children to special activities as a way to assess parent involvement with their children. While this question makes total sense in the United States, where people primarily rely on their cars as a means of transportation, it might be misleading in Europe, because Europe has a well-developed public transportation system, and parents tend to use it to take their kids to special activities. These parents will answer that they do not drive their kids, and if you don't take into account this cultural difference, you may erroneously conclude that they're not involved in the lives of their children. Instruments such as MMPI and Rorschach test rank high in cultural bias, emphasizing the need for more culturally sensitive assessment tools. The DSM, a vital tool for social workers, has faced criticism for its lack of consideration for disorders resulting from oppression. However, the DSM-5 version has incorporated cultural considerations in its assessment strategies. These strategies emphasize the importance of understanding the cultural context of illness for effective diagnosis. This includes recognizing the impact of racism on psychiatric disorders and the biases that can affect diagnostic assessments. The DSM-5 has updated its outline for cultural formulation, which now encompasses a comprehensive cultural assessment of the individual, including their cultural identity, cultural conceptualization of distress, psychosocial stressors, and the relationship between the individual and clinician. In addition to that, the DSM-5 introduces cultural concepts such as cultural syndromes, idioms of distress, and cultural explanations or perceived causes of symptoms. It also includes culture-specific concepts of distress in its glossary. Social workers need to familiarize themselves with these advancements and utilize culturally grounded techniques in their assessment. So, what assessment strategies for multicultural practice should be used? Revised tests have been adapted to capture the cultural context of mental health issues, often through translations of popular measures. Examples include the Chinese version of the Quick Inventory of Depressive Symptomatology and the Vietnamese adaptation of the Depression, Anxiety, and Stress Scale. It's ideal for practitioners to utilize tests normed on a client's ethnic population, but such tests are rare. The Communities That Care Youth Survey, CDCYS, commonly used for general populations, was recently validated for Native American youth. Some measures assess constructs unique to specific racial ethnic groups, like the Scale for Racial Socialization for Adolescents for African Americans, which evaluates the influence of parental racial socialization. Sympatia Scale, for example, measures sympatia, Hispanic cultural script prioritizing the avoidance of interpersonal conflict. Assessing a client's cultural identity, ethnic identity, acculturation, and acculturative stress is crucial in interpreting standardized test results and understanding the client's well-being. The development of culturally sensitive scales, like the Hawaiian Culture Scale, is a first step in validating the role of ethnicity in psychological adjustment. Practitioners should consider cultural identity as a moderator variable and utilize measures that provide insights into the client's cultural self. Studies have shown the positive impact of a strong cultural identity on mental health, self-esteem, and social support satisfaction. Acculturation has been linked to mental health outcomes and acculturative stress. The racism-based trauma should be included in assessments for ethnic minority clients. Instruments like the acculturation rating scale for Mexican Americans, the scale of racial socialization, and the multi-group ethnic identity scale can be useful tools for practitioners in assessing cultural identity, acculturation, and acculturative stress. Thematic apperception type tests, such as the Tell Me a Story to Mass or Dominique, provide valuable alternatives to traditional assessment tools for historically excluded racial or ethnic clients. The TEMAS test is a comprehensive assessment instrument with reliable and valid scoring system for Hispanic, African American, Asian American, and White American children and adolescents. The Dominique, a cartoon-based questionnaire, is effective in assessing anxiety and depression in children aged 6 through 11 years, using drawings that convey situations based on symptoms of 7 DSM-Axis 1 diagnoses, including ADHD, conduct disorder, separation anxiety disorder, overanxious disorder, and simple phobia. These tools challenge Eurocentric assumptions and offer culturally sensitive options for practitioners, allowing them to better understand and address the unique needs of their clients. Qualitative assessments, including self-monitoring and individualized rating scales, provide valuable insights into a client's interpretations and beliefs about behavior. Culture-specific matters, such as life histories and interviews, are crucial for eliciting assessment information. Furthermore, practitioners should employ a combination of assessment strategies, blending qualitative and quantitative techniques, or utilizing multiple standardized instruments. For instance, the Eagle Lodge Behavioral Health Treatment Center combines psychosocial qualitative assessment interviews with the Thematic Symptoms Inventory Index. When assessing mental health in historically excluded racial ethnic groups, utilizing multiple screenings can be beneficial. For example, the CESD was used to study depression with clients who come from various cultural backgrounds, such as Puerto Rico or Ukraine. The Integrative Skills Assessment Protocol, which focuses on assessing the client in an environmental context, is recommended as an effective integrative assessment approach. Evidence-based, culturally sensitive assessments are evolving. Social work practitioners must scrutinize and adapt standardized assessment techniques to ensure cultural appropriateness. Invalid assessments or inaccurate diagnoses can undermine client interventions and progress evaluations. In this video, we looked at different multicultural assessment approaches that social workers can incorporate in their practice. In conclusion, let's remember that our diverse world is rich with various cultures, beliefs, and traditions. As social workers, we must strive to respect and honor these differences, continuously educating ourselves and evolving our practices to be inclusive and culturally sensitive. By doing so, we can truly make a positive impact in the lives of our clients, understanding them as unique individuals with rich cultural backgrounds and assisting them in the best way possible. Remember, our goal is to promote a sense of belonging and acceptance, which ultimately contributes to a harmonious and inclusive society. So let's embrace diversity, celebrate our differences, and commit to providing the best possible care to everyone we serve.